So it's through the Western Michigan General Surgery program, and essentially global surgery elective, we basically went to Liberia for 28 days, so 4 weeks, and we went there to go and integrate with the one surgical residency that is in Liberia to learn from them, and hopefully, we brought some knowledge as well. And then we rotated between 2 hospitals. One was John F. Kennedy Memorial, which is the hospital with the surgical residency, and then we also spent a portion of our time at Elwa Hospital, which is run by I think it's like an interdenominational evangelical organization. They fund that hospital, and so there's a surgical department there as well, and we were able to do some cases there and interact with the surgeons who run that hospital. Kind of to set this up, I guess, Liberia has a really long history. It has been through 2 civil wars, all basically within a 23-year period, and it was all very recent. I believe the Second Civil War ended in 2003, and so that's only, what, like 20 years ago? Yeah, and so, at that time, like, a lot of people lost their lives. I think they did a survey in 2004, the unemployment rate was 80%. So this is a country with that lacked a lot of resources, both in everyday life as well as in healthcare. So basically everything was different when I got to Liberia to do surgery. On the broad scale of things, the hospital system doesn't run as well as, ones we're used to in America. Obviously we're not perfect here in America, but, once you go to somewhere abroad, such as Liberia, you kind of realize, there are like very complex operations that happen behind the scenes that we don't really think about to get a patient from point A to point B. A really noticeable difference if you were to go there would be that the patients and their family have to pay for everything on the front end. So like while you and I, like if something happens to us and we get sick, we go to the hospital and the expectation is that, we're expecting to get care, especially if we're critically sick, like very ill. We expect that somebody does something about it right away, and we get billed on the back end. But in Liberia, everything gets paid for on the front end. So like labs, pain medication, antibiotics, even the surgeries. People can be really sick, and if they don't have the money, then there's really nothing we can do. So that was a big difference. Otherwise, their resources are a lot. They don't have as many resources as us, and I was expecting one level when I went there, like, oh, we probably won't have the right suture type, or very small things. But then I got there and I realized, like, they were using instruments that were donated from like the 1970s, instruments that we used to operate with that we use like in the hospital one time, one for each patient. They were using over and over again on like multiple patients. When you are in a place like Liberia, that's really not the case, and people would come in very sick in American standards, what we would think as needing surgery within the hour, and they would not get surgery for even a day plus, from my experience. Because at every level there was some barrier. So like I had mentioned before, the money barrier was one level. If you were able to move past that and they were able to pay for everything and all the labs that you would need, sometimes the elevator, so the hospital was 5 stories, and there was an elevator that led from the ER to the operating room. The elevator didn't work all the time. There were times when it stopped working for 3 hours, and those were 3 hours we couldn't get the patient safely up to the OR, even though they needed to be up there, 3 hours ago. Yeah, and so if you got past that, it would be, if the electricity was working in the OR, if there was enough staff to run anesthesia, if we had enough instruments and materials to even kind of push the case through. So at every level there was something stopping us, and It's just not something that you would ever see in a first world country such as here. Now, that being said, that was like my initial experience at JFK, which I would describe as like kind of like the government-run hospital. At Elwa, which, like I had mentioned, was funded by the missionaries, it did tend to go a little bit smoother. There were definitely barriers, and patients didn't get to the OR as fast as, again, here, but I saw like tended to run just a bit smoother. Some of it was like everything was on one level, so you could roll them into the OR. You didn't have to wait for an elevator. Right. And some of it was, there was more funding. That ultimately was what it was. So it really changes like your perspective and your life in ways, and how you look out on things. It's like it's core memory forming. Yeah, it's definitely something that I would be interested in doing again in the future. Dr. Downing is very committed to going to Liberia, and he's done so before me with like different residents in the past. He's done so, like on his own. And so, he's somebody that like has dedicated his life to, global surgery and, helping people in third world countries. I hope to kind of, integrate global surgery and going to third world countries and helping out later on in my career. I just don't know how much because he's very involved. I think I'll fall somewhere in the middle. I think overall one of the main goals in my perspective of going to do global surgery electives for 28 days or even longer, I think the value in it is to go there to have an open mind, to not only go there thinking that you're offering something to the population that you're going to go help, but to also expect that you're going to learn something and gain something from the experience too.